This is a common question that people are concerned about, because cancerous growths of the large bowel are colorectal cancer, which is commonly known as bowel cancer. Now, these start on the inner lining of the mucosa of the bowel and gradually grow outwards through the bowel wall. They usually start as little polyps, which are little outgrowths on the lining of the bowel, and then potentially those polyps can develop into cancers. Bowel cancers are very slow-growing tumors and have a pre-cancerous stage called polyps, which are small lumps on the lining of the bowel, like pimples, and can take several years to change into cancers. Even once cancerous changes happened, progression from early to advanced can be quite slow, often taking a year or more. Now, polyps can often be removed by colonoscopy, which is a camera examination into the large bowel, thus avoiding surgery. Even when a lump is turned cancerous, if the surgery is performed at an early stage, then the patient may not need any further treatment such as chemotherapy. And therefore, the bottom line is that the earlier the cancer is diagnosed, the earlier the cancer is detected, the more likely it is that we can achieve a permanent cure and lower the chance of any recurrence. Bowel cancer has got predominantly the symptoms are rectal bleeding, either mixed with emotions or just only on the toilet paper. Now, this is especially true if it is persistent for several weeks, and the bleeding might be bright red. In some cases, it can even be all blood with clots. There may not be a large amount at all, it may just be little spots. So it is not the volume of blood that people need to be concerned about, it's just the fact that there is bleeding. Any recent change in your bowel habits needs to be taken seriously, especially if it is persistent, not just a one-off because you had a dodgy curry, for example. Not obviously related to any dietary changes or changes in medication, etc. Symptoms like abdominal pain, weight loss, these can also occur, but sometimes bowel cancers cause no symptoms at all until they're very advanced, when they actually may present as emergencies with complications such as bowel blockage or perforation needing emergency surgery. Now, this is why there is a screening program in many parts of the world, including here in the UK, of course. And the idea is to detect any bowel cancer or precancerous polyps in people who have no symptoms at all, so that they can be diagnosed and treated at an early stage with excellent results. Now, screening involves a stool test, which checks for microscopic amounts of blood, and if positive, a colonoscopy is arranged. Now, different healthcare systems have different age criteria for when bowel screening is commenced, and the frequency of repetition. If someone has any bleeding per rectum, bleeding from the back passage, or change in their bowel habits, I would strongly advise that they should see their own doctor or a specialist. Often the symptoms may just be due to something simple, but it's much safer, much better to get it checked out early. Well, first of all is a thorough examination by a competent professional, including a rectal examination. Specific tests may need to be arranged, such as blood and stool tests, a camera examination of the large bowel, or scans. Now, the camera test can be a full or a partial colonoscopy. Partial colonoscopy is a flexible sigmoidoscopy. These are done using narrow flexible tube inserted into the back passage to examine the whole of the lining of the bowel. CT scans are also commonly used, which are whole body scans, but specialized to look at the large bowel in more detail, called a CT coronography. For cancers in certain situations, we arrange MRI scans, and then there are more specialized tests, things like PET scans, for example, which may be required in some cases. For more information on this and all the other related subjects, please visit my colorectal education website, www.colorectaleducation.com. This is a free site. And once you access it, please go to the patient section where you'll find a lot of useful information, including patient stories. Patients have been very generous to share their own personal experiences, and detailed videos to explain each step in the process, including these tests that I was just talking about.